this lecture in our ECG series, we are going to talk about atrial tachycardia and its different types. Atrial tachycardia simply means fast heartbeats coming from the atrial chambers. There is a whole bunch of different kinds of atrial tachycardia. We are going to discuss each and every one of those and try to put things into perspective. What I have done here with this pie chart is give you an idea of how often you will see the different kinds of tachycardia. Atrial fibrillation is the most common atrial tachycardia, and we will discuss it in detail in later videos. Atrial fibrillation occurs when the electrical signal in the top chamber is going all different directions in a very disorganized, chaotic fashion, and that causes a very specific type of rapid heartbeat coming from the top chamber. Atrial flutter, on the other hand, is a rapid heartbeat coming from the top chamber, where the electrical signal is basically traveling around in a circle. And the atrial rate is somewhere between usually 225 to 325 beats per minute, somewhere in that range. Anything slower than that will generally fall into the category of supraventricular tachycardia or atrial tachycardia. Atrial tachycardia is generally an abnormal rhythm originating in the top chamber at rates anywhere between 100 and 200 beats per minute. It can be faster as well, but when it gets over 225 or so, we start to think of it more like as atrial flutter, although you'll see that sometimes it's kind of hard to tell the difference, and it's really kind of a matter of what you would like to call it, depending upon what it looks like. So in these videos, we are going to be talking primarily about atrial tachycardias as a type of supraventricular tachycardia. That's what SVT stands for. Supraventricular just means it comes from above the atrium. So this includes a whole bunch of different kinds of atrial tachycardias, including some that actually originate from the AV node itself. We will talk about those in more detail later, but for now, we will show you what they look like and familiarize you with how to diagnose supraventricular tachycardia. Well, in the grand scheme of trying to organize this discussion of atrial tachycardia, there'll be 4 videos. This video is going to be about atrial tachycardia and paroxysmal supraventricular tachycardia. The two of these are often grouped together because sometimes it's hard to tell the difference. But let's just say that in atrial tachycardia, you can generally see the P waves in front of each beat, whereas in paroxysmal supraventricular tachycardia, the P waves may or may not be apparent. So we're going to start with our first strip here, and in this rhythm strip, if you kind of glance across and look at the farthest, you'll see that there seems to be a sinus beat that kind of stands by itself in the beginning, and then suddenly it appears that the heart rate increases significantly. This sinus beat does have a P wave in front of it, and the PR interval looks to be at the upper limits of normal, probably 180 to 200 milliseconds. And the next sinus beat seems to be over here with a heart rate about 300, 150, 175, 60. So it's a little bit faster than 60 beats per minute, probably 65 or so beats per minute. And you would expect the next beat to occur in here someplace. But you can see that there is a P wave here that starts off something here, something rather fast. The first beat occurs somewhere above 100 beats per minute, but you can see that there's a slow increase in heart rate by the end of this. We are talking about just over 150 beats per minute, like maybe 155. One thing you can characterize this as having a gradual increase in heart rate. It's a rapid heartbeat, so it's a tachycardia. You see P waves that start the tachycardia, and the QRS complex looks exactly the same as the underlying QRS complex. So what would appear to be coming from above the ventricles? So it's supraventricular, and you see this P wave that starts it off. So it's appropriate to call it atrial tachycardia, or AT for short. Now, one thing about atrial tachycardias is they can occur at rates anywhere from 100 up to 220 beats per minute. This one happens to have a particular pattern in that it warms up. A warm-up phenomenon means that the heart rate gradually increases as the arrhythmia progresses. Now, what you need to start doing now is pay attention to the little details, because this is how you'll make the diagnosis. If you look in front of this beat looks the same as that beat. So where did it come from? This T wave is very smooth, and if you compare it to this T wave, what do we see? We see a bump. And that bump, of course, is the P wave that gave rise to this QRS complex. So, clearly there's a P that is in front of this beat. And if we look at the next one, we see a P here, and we see a P here. So there are P waves preceding each beat, and it starts to get interesting as you get to the end of the tachycardia. Where are these P waves? Well, I think it's clear that there's one here. But now what happens is there are two bumps. Now, which is the P and which is the T wave? You would expect that maybe this is the P because it's in front of the QRS complex. But remember, we have a PR interval that's somewhere between 180 to 200 millisecond range. So if you measure back from this QRS complex, you'll see that this is probably the P wave. Now look at the next one. You still see two bumps, but they're much further apart. Which one has moved? Which one looks like it's associated with the QRS? I think that's the P wave, because that's closer to the QRS. But it turns out that this is the P wave. Now, how can you say that? How do you know that? Well, it wasn't here. And it's unlikely that the T wave moved, because the QT interval cannot suddenly shorten. So because this is the signal that's moving, it's likely that this is the P wave. But I can prove it to you, because when you look at this beat, you can see a bump right there. And that cannot possibly be the T wave, because that QT interval is not physiologically possible. And this conducts to this QRS with a fairly long first degree, somewhere about 280 milliseconds. And then this happens to be the last beat of the tachycardia, because here there's no P wave. But what you do see is a T wave that looks exactly the same as this T wave. This T wave and this QT interval is the same as this QT interval, and this is T wave. So this T wave, that's the T right here, and the P wave is this bump that comes after the QRS. Isn't that cool? So if you carefully dissect this strip, you can get the sense that the P's can march around, and they can change their position with respect to the previous QRS complex. And that gives you a hint that that's the P. It's kind of marching on through. If you count this as the first beat, you have 1, 2, 3, 4, 5, 6, 7, 8 beat run of atrial tachycardia with a warm-up phenomenon that started at 100 beats per minute and sped up to about 155 at the end, had a bit of a first-degree AV block, but that's exactly what you would diagnose this tachycardia as. So we are getting into some complicated territory over here, and I hope you guys keep up. But the beauty of internet learning is that you can play this back over and over again until you truly get it. Right. In the next lecture, we will go deep into paroxysmal supraventricular tachycardia. Until then, keep watching this lecture on repeat.